So today we're going to explore what is causing your knee replacement to click or clunk.
Or click and clack.
There we go.
We'll let you know.
Bob and Brad, the two most famous physical therapists on the internet.
Okay, we have an expert, Brad, that's going to answer this question, and we'll let him play now.
He's a knee surgeon.
Right.
All right, let's go.
I would say there's probably the majority of knees click in some way or fashion, and the part of that is just the nature of how your knee mechanics work. So, your knee is not like a hip where it's a ball and socket that stays tightly bound to itself the whole time. Knees pivot, they turn. It's not just a perfect straight forward and back joint. And so there's rotation that happens. Your ligaments are elastic, right? So they are supposed to stretch some so that your knee can pivot and bend and move into different positions. And so when that happens, if you have two hard surfaces, metal and plastic next to each other, as those pivot and twist and turn and stretch, you're going to feel and hear little clicks. So I see that in most patients. Some people don't notice it or don't care.
Sure.
Some people, it really does aggravate them a little bit. And I would say 99% of the time, those clicks and noises are completely normal.
Gotcha.
You do see some patients where, as we're trying to surgically recreate their stability, we underestimate that. And there can be too much movement in the knee.
Gotcha.
So those tend to have more clicking and clunking, but they also tend to have a lot more other symptoms. So swelling, potentially pain, giving way where their knee wants to kind of cave in on them. So there can be a problem there.
There's
but
really
the vast majority of clicking is not an issue.
You can't do anything about it, right? I mean,
no, you really can't. I kind of actually have learned as I've done more of this. You'd think the tighter you can get those ligaments to be and the more stable it can be, the better. But I think a little bit of clicking in your knees actually probably expected and probably a good thing, because really, if you look at natural knee mechanics, there is stretch and pivot and movement in your knee. And if you want it to, if you're looking for that function, that's something that is actually probably a benefit after your knee replacement.
Okay, that was Dr. Dane Hansen, by the way, a
good.
Norwegian.
Oh, wonderful,
And
wonderful.
he does a great job, I thought. But in addition to that, if you are feeling clicking and you're having pain along with it, you should definitely see your doctor about it.
Right. I've had a number of patients over the years clicking after surgery. They're a little concerned. No pain with it. We just continue with it, get it stronger, and things fall into place, and everything is good.
Yeah, we have found the stronger the knee, the less clicking there.
That's
so
right.
we're going to show you a couple strengthening exercises right now, too.
I'm going to get out of your way, Bob, because
All right.
I can see you've got a mission.
All right, the first one is actually to strengthen the quadricep, the muscle on the front of the thigh.
Sure.
So all you do is take a pillow, half, and fold it in half. And what you're going to do is actually push the knee down to the bed.
Squish that pillow.
Yep. And while you're doing it, you're tightening this muscle, the quadricep.
So basically, it's kind of like an isometric, because as you hold it.
Somewhat, yeah.
Yep. We're probably not holding it quite that long, but how many repetitions, Bob?
Oh, at least 10.
Yeah.
We like 10,
Yeah,
right?
you can't go wrong with 10.
3 sets of 10, probably.
Mm-hmm. Again, no pain. You should feel those quadricep muscles fatigue, get tired, and that's fine.
A great one to do.
All right, Bob, after you get your quadricep strengthening done, we want to work on the opposite muscle group, the hamstrings. In the seated position is one good way to do it. So we can just hear, and your hamstrings work when you pull your foot towards you like this. It's all hamstrings. So when you work with this, particularly in the beginning, you don't want so much resistance because you don't have the strength.
You probably can't tolerate.
Right. So if you have carpet, you can put something slippery down, like this piece of plastic is a clipboard. We've had people use plastic bags, cookie sheets, and you go back and forth.
Just a dish rag on it if it's a vinyl floor.
Yep. vinyl floor, wood floor, plastic floor, I don't know, whatever they are. And you also want to do your range of motion and use the other leg to pull under. Now,
Get a little stretch.
one thing that works well to increase resistance as you get stronger is we want to go uphill, add some resistance. We are going to show something that we've shown many times in the past, and it's because it works well. This does the same thing. It's our knee glide, but it does have this option as a stilt, and this works very well for increasing resistance on that hamstring, and you get good range of motion in the knee.
It's definitely more a challenge.
It is. And as you get stronger, you can simply put some weight to add resistance, using an ankle weight like this. I've got a nice little 3-pounder here we're going to add. And again, we're going to do 10, 15 at the most. And that makes quite a difference. And where you position your body helps.
Right. You
You'll
could
learn.
also have your toddler grab onto your leg and swing back and
There
forth.
you go.
You know how they do that?
Yeah. This is actually, you can flip it the other way around too. And this
work
is,
on the quadriceps.
Yep. And then you got quadriceps.
Yep.
There
Works
you go.
quite well.
All right. Well, very good. What's
Give it
next?
a shot. That's it, Brad.
That's it. Say no more.
Stop the clunking. Unless you want to do a sit to stance.
Well, maybe we should add
Okay,
that
sure.
because it is in the chair, and it's a real functional. You're getting your hips involved,
Right.
quadriceps, and it's simply stand up to here and back down. Use armrests. If you can do 10 of those, it's pretty easy. Then it's time to take your hands away. The next step is to the knees. Make sure you get up nice and tall so you're aware of good posture. As you get stronger, hands go up to here. 10 of them again. And at that point, you're good to go.
You're good.
Yeah.
There we go. We can fix just about anything, Brad.
Oh, yes, except for...
A broken heart. I thought you were going to work on it.
Yeah, I was. Last night I was thinking about it, and then I said, the
That's
heck
where
with
it
it.
stopped.
I'm going to have some ice cream instead.
Good for you. Thanks.